I have no PowerPoint. I'm not that well versed in electronic mechanisms. My feeling about this is that we do not know, bottom line, what's going to happen or what is not going to happen. But we do know that all through the history of medicine, when there's something that affects people, we need to be careful what it does. When we started 35, 40 years ago, there was no such thing as a fetal alcohol syndrome. Now, all bottles are labeled for pregnant women, you should not drink. It doesn't mean that every woman that drinks is going to have a child that has fetal alcohol syndrome. But you need to be made aware of the fact that this could happen. The same thing with tobacco. Yes, tobacco causes cancer, but it doesn't cause cancer in everybody. I have patients that are 90 years old that are still smoking and don't have lung cancer. But that hasn't stopped us from warning people the possibility that you can get cancer. What this Bodywell chip does is give us a safety net for everyone, but more especially for our children. Brain tissue is extremely friable, if you'll excuse the expression, in a child. It has not matured. The nervous system does not mature until you're in your late teens, early 20s. So whatever effects you can stop from affecting those tissues is something that should be given to our children. But you go ahead and you think about it for older people. We use those phones. Some of my colleagues keep their Bluetooth in their ear. They walk around with it. They're constantly on it. That has got to have some effect. There are anecdotal studies that show that trauma of any kind can cause a benign brain tumor called a meningioma. Well, it shows that these waves are trauma. So there is a benign tumor that may well be attributed to. We can't do studies on human beings. We cannot go out and say, okay, you don't use the chip for 50 years and you use the chip for 50 years, and then we're going to do a study to see what your brain looks like. I mean, that's totally unethical, immoral, and wrong on any sense of the thing. We have to use our common sense, and I think this is a perfect example of where common sense trumps scientific evidence, because we can't produce that evidence in human beings. The studies that have been done on simulated tissue are excellent. They have been certified and repeated and repeated and repeated. And as a neurologist, I certainly would not want a child or an adult to have any kind of radiation that could affect their electrical activity. By definition, an abnormal electrical activity, or spikes, is a seizure. I certainly would not want to have a patient develop seizure disorder because they used a cell phone without protection. And I think this is the cutting edge of something that is extremely important to us as human beings, and I hope that you all take the message home that we don't have concrete evidence because we're dealing with people. Thank you.